went into a hard lockdown to limit the spread of coronavirus. On this day, a year ago, the country had recorded 1,170 COVID-19 infections and 1 death. But since then, the numbers have skyrocketed. The National Health Department has recorded well over 50,000 deaths and more than 1,551,000 COVID-19 infections. We now speak to internationally renowned virologist Professor Barry Schoub, who's also been one of the members of the advisory committee to the Minister on Health. Prof, good morning and welcome to the show. First of all, let's start off here. What do you think are some of the lessons we have learned since today marks a year since we've gone into a hard lockdown?
Yes, good morning, Aldrin, and thank you for having me. As you say, it's a year since we've gone into hard lockdown. I think we've learned a lot because this is, I should take a step back and say this is a new disease. It's a new thing. We're all in a learning curve. And in fact, there are no world experts in this field. We are all picking up information, and things are surprising. We never foresaw right a year ago that we'd have the variants that we have now, which are resistant to vaccines. So these are some of the things I think the main thing that we need to that we have learned is that we need to have a completely open mind. We need to rely on science. We need to look at scientific evidence, and based on that scientific evidence is really how we make our recommendations. Obviously, we as a MAC, we don't make decisions, we make recommendations, and the recommendations would go to the Minister, would go to the NCCC for them to make the decisions. But I must say that we've had a very, very good working relationship, and our decisions and our advice is really based on the best science that's available. But the science is dynamic, it moves, and it needs to be critical in that respect.
And for you personally as well, because you also come from an academic background and now having to deal with the situation of a pandemic, which of course we're dealing here with a novel virus, and on the other end you still have the bureaucracy that comes with them when it comes to issues of the state. How has that been for you personally, though?
Yeah, look, it is a challenge, and it's a challenge because there is scientific evidence, but there also are various administrative hurdles which need to be cleared, and these are necessary. I'm not criticizing them by any means, but there are necessary administrative hurdles which do need to be cleared: financial hurdles, administrative hurdles, contractual hurdles, and I think we've got to be realistic about it. Our mandate is a scientific one, which in some ways may be the more straightforward one, but we do need to kind of intercalate it and interdigitate it with the other governmental issues. And unfortunately, these governmental issues have really become global, and particularly the vaccine issues become very politicized globally, as we all know. And this is unfortunate because vaccines, I think, should not be treated like an ordinary commodity. I think they're a very special commodity because we're dealing with an infectious disease which affects everybody on this planet. And everybody is affected, and everybody will be affected until everybody is safe.
And we now see a phrase that, it's a new coined phrase, really, that started hearing towards the end of last year, and that is vaccine nationalism. And we've seen with the World Trade Organization trying to address that particular question. What do you think we can do even further now, speaking from a global perspective around the rollout of the vaccines and making more vaccines available? Because some countries seemingly didn't want the COVAX facility route, didn't feel that the COVAX facility route would be efficient.
Well, you see, we as the MAC advised when we started, and our MAC really only started in the beginning of September last year, so it's a fairly new ministerial advisory committee. But we strongly advised participation in COVAX because that COVAX was really set up to attempt to find global immunity with regard to vaccine provision. So we strongly supported COVAX, but we also did, right from our very first advisory, say that the government should continue with the bilateral negotiations, which had started well before September, bilateral negotiations with the vaccine manufacturers, so we could have supplies to the country of both, from the bilateral as well as from the COVAX allocation.
Mm-hmm. Then what then do you make of the critique against the state that currently, as we're speaking now, we're marking a year since we went into hard lockdown, and we really don't have any vaccines that have been made available to the general public. We know that with the Johnson & Johnson vaccine, this is also just part of a trial.
Yeah, it's not really a trial, I must correct it. It's actually a study, and there's a big difference. Because it's not a trial means that you're actually evaluating something which you don't know anything about, and you're comparing it to a placebo. This is what's called an implementation study. In other words, this vaccine is well known, has been examined, it has undergone a trial, it is undergoing registration, it has been licensed by the FDA in America. So it's not a trial as such, it's a study, it's an implementation study. In other words, it's given to people without any placebo. The only difference really is that people have to give informed consent, and it can only be given at certain vaccination sites. And the idea is that we can really kind of study how is it behaving in the field. So it's really a studying, and these vaccines were given to the country by Johnson & Johnson to in fact do this study and do this observation of how it works in the country. But you're right, there is impatience, myself amongst them. I haven't been vaccinated. And we are all kind of anxious, we're all kind of nervous, we all are impatient, we want the vaccine to come as soon as possible. But unfortunately, the kind of reality is that there is a limited amount of vaccine which comes down the pipeline, and there's a global competition for this vaccine. So I think that I must mention that the Department of Health are very, very hard at work, really 7 days a week, right into the night, trying to negotiate these contracts so we can get vaccine into the country as soon as possible.
Mm-hmm. When there was also this study looking into the Johnson & Johnson vaccine and also the AstraZeneca vaccine, and the decision that was taken at the time to hold back around the rollout of the AstraZeneca vaccine because of what the study has revealed. Then there was a recommendation that was made that at least 100,000 doses of the AstraZeneca vaccine should be rolled out, which would then be part of a study. Has government accepted that recommendation at all?
You see what happened. Look, this is very unfortunate. We had planned on AstraZeneca vaccine, which had worked very well overseas, but of course they don't have the dominance of the variant that we have, that 501YV2 variant, which is dominant in the country. That's about 95%, if not more, of our viruses. And the problem is that specific to AstraZeneca vaccine does not specifically work against this particular variant, which is dominant in the country. So it was a hard decision, but the decision was really based on scientific evidence which came from the laboratories and scientific evidence which came from the trial, that the vaccine, there was no evidence, no scientific evidence that it would be effective. And therefore, and also the vaccine was had a limited lifespan, so it was felt that it would probably be a lot more valuable in those countries which don't have this particular variant, or very little of this variant. And therefore, the decision was made to rather give it to the African Union platform. There was an initial suggestion to maybe do a trial of 100,000 doses of the AstraZeneca vaccine. The only problem with that, of course, is that does kind of use up resources to administer it, and also there was a limited lifespan of the vaccine. So all in all, it was probably, the decision was really taken by the Department of Health to rather provide it to those African countries where it would be very valuable, rather than doing the trial.
So does this mean that the AstraZeneca vaccine is no longer part of our COVID-19 vaccine rollout plan?
At the moment, it's not, no.
Okay.
And the reasons for the reasons I've just mentioned,
Okay, so with the ones that have been ordered already that are yet to arrive, those ones will also be shipped to the African Union?
No, there aren't any, as far as I know, orders which are yet to arrive. There was 1 million doses which did arrive, and that's been sold to the African Union. The 500,000 doses have not been bought, not been delivered. They've been now withdrawn by the Serum Institute of India.
Okay, just a final question, Professor Barry Schoub, as we head into the Easter weekend. Do you think at all that the country should move up to alert level 2 or alert level 3 or bring in stricter measures to try and control the spread of the virus amid fears of a third wave?
Yeah, look, I think, and I'm giving a personal opinion, yes, there is a worry because the Easter festivities, there is a risk that if there's no control at all, that there's a risk of a super spreading event, like we saw with the Rage Festival at the end of last year, which launched the second wave. So it's really, I think there are two things. I think the one thing is we need to kind of propagate and need to kind of propagandarize, I should say, to the population. We need to publicize the population. Our people need to be very careful over this period of time. There is a temptation to kind of party, to have festivities, and that's really where the danger lies. So in terms of what the government should do in terms of restrictions, yes, I think as well as information to the people, as well as publicizing it to our people, I think in addition there needs to be some restrictions which need to be put in place. So I think that the level of restriction should be raised. I'm not saying level 2 or level 3. I think that's something which needs to be discussed with business and with various stakeholders to see what is the most effective way in which they can do infection control, but at the same time look at the other aspects which are so important, running the economy and other aspects of people's lives.
Thank you so much. That debate again around people's living conditions, whether it is a conversation about saving lives and a conversation about livelihoods. But thank you so much, Professor Barry Schoub, the chairperson of the Ministerial Advisory Committee on the COVID-19 vaccines. Really appreciate your time. We've come to the end of that conversation. We're going to take a quick break. When we come back, the agenda continues.